We're now going to start our question and answer panel. So if I can invite our speakers up onto the stage. And Dr. Hall is going to be chairing the session and giving you the question and then the answer. Thank you.
Just a minute, we're just sharing the questions out here just now. So exercise tone, sort of approach. Yes, while we're just sorting out the questions here, I know that Abby Macbeth has a couple of questions that I've already passed in her direction for reasons that will remain apparent. But before we start the questioning session, I'd just like to say what a marvellous experience it's been, I think, for all the speakers taking part today. And there's such a wonderful turnout and such a high level of interest, and there's really quite a sort of buzz, I think, about the whole meeting, which is wonderful to see. And it is actually for us a very exciting way to get a lot of information across to a lot of you in one go, so that you're much more, hopefully much more in control of things and much even better informed. I would say much better informed. You're already, all of you, very well informed. And I think the two talks we've just had are inspirational, because it shows how so many of you can counteract the problems that are thrown at you with marvellous results. So well done to all of you, and it's great to see so many of you here. So while I'm shuffling the bits of paper here, I'm just going to hand over to Abby for the first couple of questions.
So I've had a really good question here. What types of wigs are available on the NHS? Well, it's important to know that usually the NHS will say that you have to have 50% hair loss, so half hair loss, before then you'll be eligible for wig prescriptions. But I think there is a little bit of flexibility there if you speak to your dermatologist or if you're referred to a dermatologist. But the entitlement is that you can have 2 NHS wigs on prescription every year. And so that you will need the 2 wigs in order to be able to maintain the care. And these are mod acrylic wigs, so they're synthetic wigs, but actually they're a lot better than they used to be. You think, oh, acrylic wigs, I'm not sure, but they're very good actually, and they do wear a lot better than human hair wigs. And so I can recommend definitely going to your dermatologist and asking for that. Unfortunately, it does need to be from a dermatologist, so you'll need to get referred over to a dermatologist if you don't already see one. Hopefully that answers the question. You used to be able to put your allowance towards human hair wigs. Unfortunately, then you're not able to do that at the moment. So to pay for a human hair wig is up to somewhere between £150 and £200 sometimes. So. And another question, is there any connection between skin lupus and Bowen's disease? Or Bowen's disease is what we would call a precancerous skin condition. So it's a type of condition that may come on before you develop skin cancer. And Bowen's disease, it isn't directly related to lupus, but by being on a lot of tablets that damp down the immune system, it's very important to keep a close check on your skin and to protect your skin against the sun. And if you do develop any new lesions that you're worried about that come on rapidly, always speak to your GP or to your doctor and do that as quick as you can. And you can then be referred to a dermatologist within 2 weeks via the government rules.
I've got a question here. When I lose weight, all the fat from steroids that I've taken for years does not always go away. Is there anything I can do about it? Well, it does go back to the sort of overall picture that it may not just be the steroids that have put on the weight, and you may still be taking the other pills, I guess. But ultimately, if you're taking steroids intermittently, if you're taking any drugs intermittently, and your weight's going up and down, you need to be very consistent in the way that you deal with it. In as much as you do need to keep the sort of regular exercise up, if that's the means you're using to lose that weight. Otherwise, you've got to take a much more focused approach with your diet, and that means taking a very critical look at the amount of fat that you're eating. Because that ultimately is what's controlling the amount of fat cells that you've got and the size of those fat cells. Thank you.
I think that's good advice for all of us, isn't it? I think there's another question here related on that broad theme.
I've got another question here about how about exercise in water? I don't know if that's probably more appropriate for Wadge, but I'll have a go. I think it's, as Wadge said, and I think as we said, when you're choosing an exercise or choosing something, it's any activity really. So it's important to get something that you enjoy. And also, if we're talking about exercising or swimming or something like that, it can be quite useful if you're experiencing pain as well, because it's non-weight bearing, so it can take the weight off it. So it's something that's not as high impact as something like, say, walking. So it can be really helpful from that point of view and also quite relaxing. So, but I think the most important thing is actually to choose something that you enjoy and start it off gradually, and then set some goals for yourself so that you're doing things really gradually, and also increasing it slightly as well as you go, anything you do exercise-wise. And also rewarding yourself, because it's not easy sometimes when you're feeling really fatigued and tired to actually get out there and do it. So when you've done it, it might be enough reward to actually, recognise what you've done and give yourself a pat on the back, but it's really important to actually acknowledge that you're doing well as well. Do you want to add anything, Wadge, about the water?
I think the only point about water is that it's a very constant resistance. So, it's a very good way of working the muscles. Whereas a lot of things that we tend to do have resistance in cycles, in as much as you may make a movement with something and it's hard at one point and easy at another point. You don't use the whole muscle when you're doing that kind of exercise. With things like swimming, you're using the whole muscle. So, it's probably one of the most beneficial things that you can do, other than that sort of resistance type pack, because it's got this constant pressure on you.
I don't know if you wanted to add anything. I just thought the only sorts of circumstances where you might not want to is if you have open wounds, for example, ulcers or other skin conditions which are going to make it uncomfortable to be in water, or indeed would give you an increased risk of infection. I don't know if you have anything further to add on that, Abby. But
it's perfectly safe to exercise in water with skin lupus, as long as you don't have things like leg ulcers that require dressing. So things that require dressings, we wouldn't advise that you're swimming with those, but it's perfectly safe to exercise with other types of skin lupus.
So there are a couple of different sorts of questions here. So one person's asked whether lupus can affect the vocal cords, and this individual's had some problems with their voice for several years, having actually only been diagnosed with lupus fairly recently. And in fact, the answer is yes, it could be relevant. I mean, there are a number of ways in which lupus can affect the joints. It's a little known fact that there are a couple of little joints controlling the movement of the vocal cords, and so obviously you can get arthritis in lupus, can't you, in any joints, and unfortunately those are no exception. So you can get arthritis of the joints of the vocal cords. You can also get a bit of inflammation in the vocal cords, and if you're taking steroids, if you're taking any inhalers, particularly for asthma, for example, I don't know whether this individual has asthma, but the steroid inhalers can cause some changes in the vocal cords leading to hoarseness, or indeed can increase the risk of getting infections like thrush, for example, in the mouth and throat. And the last mechanism that might be relevant is if there's either chest disease or particularly reflux with acid coming back up the gullet. Sometimes that can come up and affect the vocal cords. So there are a number of possibilities, and obviously, and there are actually some more possibilities, but that's just a few common options to work through, and perhaps have a chat initially with your GP about, but perhaps also your rheumatologist or nephrologist or whoever's looking after your lupus. Then the next question here is from an individual who said that she gets a lot of pain in various places which moves around. I think a lot of you will be familiar with that, and she's wondering whether it's a good idea to exercise when she's experiencing those sort of migratory pains, because I think from the way it's written, she's had the experience that sometimes the pain increases when she does that. Now, we're always advocating gentle exercise, but if you're getting migratory muscle pains or joint pains, and certainly if it's gone up a level compared to what you're used to living with, then it's quite possible that you're having a flare of your lupus, and we wouldn't advocate that you increase your exercise level to try and deal with a lupus flare. What you need is some treatment to actually calm the lupus down. So exercising is good, but exercising your way through an inflammatory process isn't going to work. So if you've got active inflammation causing those sort of pains, then exercising probably would make that feel worse. So if your disease activity, if you feel, and most people after a while certainly have a feel for when their lupus is active, because it tends to do the same things in that person, although it might be very different from what it does in another person, but you generally have a feel, don't you, for when your lupus is active. And if it has that sort of feel about it, and migratory muscle and joint pains are a very common manifestation of active lupus, then getting that sorted out first, getting a temporary increase of steroids or an adjustment of your non-steroid medications, that would be a better way to go, and then think about the exercise. Then the next question here is there any connection between taking aspartame or other sweeteners and lupus activity? That's an interesting question. I mean, there are lots of suggestions that dietary factors can increase inflammatory disease, and a lot of people have individual experiences which suggest that that might be the case. It's actually devilishly difficult to demonstrate this in cohorts of people. There are a few dietary factors which do seem to consistently change inflammatory disease. So, for example, there have been studies on ingestion of fish oils, and the good news is that decreases the level of inflammatory activity. The bad news is that in order to have this effect, you've got to ingest a bucket load of fish oil. So I'm not sure it's something that most people would be terribly enthusiastic to try. Generally, we just advise a normal, healthy diet with plenty of fresh fruit, vegetables, and we don't have a problem generally with artificial sweeteners. Having said that, you know, they are an artificial substance, and one of the big problems that we always have in medicine advising people is that even if we're dealing with identical twins, actually no two people are exactly the same. And so everybody knows this. If you get a cold and someone else in your family gets a cold, you might have the same virus, but you actually can't get quite different symptoms or different severity of symptoms. And so with the dietary factors, I think it's quite plausible. In fact, I'm sure it's a fact that some people will be affected by one food substance and many other people will not. And so if you look in a cohort, in a group of people, you don't see a clear signal. So I think it's sensible to try to know your own body, and if you constantly get a bad result from eating something, well, don't. And I certainly wouldn't touch shellfish again. I mean, a very bad experience on 3 consecutive occasions, that was enough for me. So I'm not going to touch it, although lots of other people thrive eating shellfish. But generally, I wouldn't recognise a problem with artificial sweeteners, but I can't put my hand on my heart and say it could never happen.
The patient rang in with that question to the advice line, and I went to the drug information at Addenbrooke's, and they did a literature search on it, and they said that there was no evidence to support what they were saying, publishing in the papers, to link it. So there was.
I mean, if you look overall, you can't. But that's the difficulty. We can never be absolutely sure in an individual. So if you take something and it always upsets you, then I think it's worthwhile listening to your body. Do you want to take yours, Jane? And then
my question is, can lupus ease up when gone through the menopause? Well, there's lots of triggers, I suppose, for lupus, and one of them is known to be the hormone level, and that's why there's more women than men with lupus. But we have to think of people usually get diagnosed in women of childbearing age, and it can burn out and become quiet, the lupus. But I think every patient is individual, and there's no guarantees that just because you've gone through the menopause that things will ease up. Things like environmental factors, like I think Abby's spoken about, your photosensitivity in skin, things can trigger lupus, infections can. So although the hormones levels might be settled down and things might calm down, there's other things that can also keep the lupus active after the menopause.
I'm going to end with a rather unusual question, perhaps a slightly macabre sort of question, which we don't normally focus on very much. So somebody's asked if Addenbrooke's can receive bodies for lupus research after death, which isn't a question I get asked very often, because obviously we are very much focused on keeping people alive and well. But obviously we can't control Anno Domini, and we will ultimately all sort of move on to a hopefully better place. We don't have research projects running at the moment which are systematically using post-mortem material, but I think that whoever's written this, I think, would be best placed to discuss with their consultant directly, because post-mortem studies have, I mean, I've been flippant just there, but seriously, studying tissue is a very important part of understanding what's going on. And I think with some of the big worries that have been raised in the public sector, it's become less fashionable, if that's the correct word, than it used to be. But if it's well controlled and well thought out, there certainly is a place for it. But I think it would have to be done in the context of a specific question or set of questions that could be answered. But that may not completely answer the question for that individual, but I think because it is an unusual and a very important sort of question for that individual to ask, I think to talk about that with whoever's their main consultant would be a good idea. And that, I think, is it, actually. So thank you very much. Are you going to come and wrap up for us? That's excellent. Thank you for those insightful questions.
Before you disappear, we've just got a token of our appreciation for you all. Giving up your Saturday afternoons. I don't want to take away the surprise, but they say something like "thank you from Lupus UK" inside, and it's of the chocolate variety. So,
only the best. I did exclude chocolate. I did make that point.
We have put some feedback forms in your pack, as is customary at these sorts of events, so it would be marvellous to hear what you think about how we can improve these events in future. I would like to say now a big thank you to Rob Jewson, who is unfortunately unable to come today. He's poorly, but without him I don't think this event would have been what it is. So thanks, Rob, and get well soon. And of course to all our other helpers who organised today, particularly Sheila, and thank you to also the people from Hingston Hall that have made this possible. Thank you.